I was planning on not doing this article. It's another meta-analysis or review of the literature on stem cell applications for arthritis of the knee, osteoarthritis. Again, it's a very big issue, but I decided to go ahead and maybe give you a warning, not to worry about going here if you do find this article, if you happen to be looking. It was in 2014, and it's in the the World Journal of Stem Cells. Now, why would I warn you against doing that? Well, go back up to this point. It's in 2014. Things have changed so much in the past, 4 years, that 2014 is light years ago and light years back in terms of stem cell therapy. This article, it does go ahead. If you haven't read any articles on this or seen any videos on it, then okay, it does give you some background. It makes it clear. It helps you understand how important a source of disability knee osteoarthritis is, and it does give you some a good image here. This is the breakdown of the knee, and this I think was very, very helpful. This shows this is a microscopic view of the cartilage within the knee. First of all, as you start to look at this from a gross perspective, gross is a medical term here, not gross ugly, but gross meaning large. Gross versus microscopic. The gross image shows what docs will call ratty or mouse-eaten, just basically osteoarthritis, some challenges with the cartilage itself. Microscopically, you see, again, that ratty image. You see ragged edges on that cartilage. You see big gaps down in here. And this actually does help you understand a little bit more about the microanatomy. So, again, maybe not a totally worthless article, but beware that of what you're getting if you do look it up. I would go back to my other video on it. There was a 2017 Acta Orthopedica or Scandinavian lit review. Go look at that one. I'll put both of those under the video itself. Another thing you can learn, though, from looking at this is this whole issue of scaffolding. Remember, we've talked a couple of times, and we'll probably mention it a few more. Scaffolding is a big, big issue. And what that means is, if you just pour cells in here, what are the cells they're going to attach to? They'll just flow in and back out. Hyaluronic acid is a thing we'll talk about at some point later, but it's a type of scaffolding. There are other types as well, I believe. That's part of what I'm learning right now. But you have to have some scaffolding in here in order for the cells to attach. Once they attach, then they can start growing and creating cartilage. What else is worthwhile in this article? Again, a good summary of how prevalent it is. And actually, he gets into detail. These guys get into significant detail on the prevalence of disabling osteoarthritis by region of the world, including East Sub-Saharan Africa and West Sub-Saharan Africa. Both of them are 0.15, or West Sub-Saharan Africa is 0.1574 and East is 0.1544. Didn't know that, did you? I don't understand what the units are either, so I don't think that's that significant. He does go into some detail. Again, 2014 vintage discussion of stem cell management, stem cell treatment. He doesn't even get too deep in terms of discussion of the techniques and differentiation between the two big competing techniques over the past few years of platelet-rich plasma versus marrow aspiration stem cells. he does talk, only mentions 4 or 5 clinical trials. Maybe there were only that many available at that time. He does say there's a big future in this, and we need to get some standardization. So again, thank you for your interest. We'll have plenty of other videos on stem cell, starting off mostly with stem cell for the knee.